Hello and welcome to the Aaron Werner podcast on iCode Media. Today I want to share my thoughts really as a reflection of the episode that Chris and Renato had regarding Vision HQ. I thought it was a fantastic conversation. In fact, I listened to it twice on my runs this week because I thought the first conversation was so good I wanted to listen to it again. And I had some reflections, some thoughts. Um, if you follow me on LinkedIn, you know that I love my Oakley Vanguard metas that I run in. And so I had actually recorded some reminders, some notes from the conversation while I was running. And I want to share those with you all. So if you haven't listened to their episode yet, I've linked it in the show notes below. So please listen to that probably first and then come back and listen to this. Or heck, do it in the reverse order, whatever works for you. First and foremost, my practice, I believe, was one of the first, if not the first, to engage with Vision HQ for membership plans in the United States. I actually had the opportunity to work with them when they were coming from the dental side as Dental HQ over to the Vision side and creating a new entity called Vision HQ. There's lots of overlaps and synergies between optometry and dental. There's also some very stark differences between the two, and had the opportunity to work with them as they navigated those and built out the platform. I'm not a KOL. I still use Vision HQ in our practice. We pay just like anyone else would for the program. Really, my goal is in working with them was to help fill a need that our patients have and that our colleagues have in creating access for patients in our practices. So when I listened to the conversation between Chris and Renato, that was the word that kept coming back to me, is access. This is why my practice engages with Vision HQ. It's why I work to help the company move from dental over to vision. Really, it's all about patient access. So Chris and Renato did a fantastic job of talking about what membership plans are and that they're not insurance. I don't even look at it as a soft not for insurance. They're two very different things in my world and in my practice, and we use them as such. So it is not an insurance. It is not a replacement for insurance. It is not trying to get somebody to choose between paying for managed vision care benefits or a membership plan. They're two different things, and I think we treat them as such. And once we realize that they are two very different things, managed vision care and insurance, and then membership plans, it became a lot clearer for not just myself, but my staff and then our patients. So I know there's a difference between managed vision care and medical insurance. For the sake of this conversation, I'm just going to refer to both as insurance. So I mentioned that the reason that we wanted to engage with membership plans in my practice was access to care. And what I had realized was that we were always trying to increase access to care and value and really tying a dollar amount to that in the form of discounts. So if an individual was a cash pay patient or they were paying for something that wasn't covered by insurance, then because we're optometrists and we want the best for our patients and we want them to have access, we were giving discounts. We gave a discount because you were cash pay. We gave a discount. Sometimes we called it prompt pay discounts. Sometimes it was because the day ended in Y. But if you were anything like my practice, we quickly went to discounts. And that never really sat well with me, but that's just how the industry ran. That's how the conversations I had with my peers happened. And so that's what we did. I wanted to get away from that because I didn't want to be a discounter. Now, and by no means is our practice inexpensive. I think we're affordable, but I think we're on the high side of affordable, and we do very well with what we do. But I still want every patient that walks in the door to have access. So get a little bit of the lay of the land. I'm in Southern California and San Diego, so very, very, very high percentage of our patients have insurance. And that's not insurance that they chose to purchase. Most of those are insurance benefits that were provided by their employer, including their managed vision care benefits. So for them, it wasn't a do I choose to pay cash or do I buy a managed vision care benefit plan. It was just something they have, and they have it, they're going to use it. I'm the same way. If I've got an opportunity to take advantage of something and get additional value, I'm going to do that. So that's what we saw in our practice. When we built out our membership plans, we built 3, and we built them with one intent. And when I saw how they were used, it surprised me. So what we built out was a eye wellness membership plan that had a benefit for a annual wellness exam, and that included our OptiMap screener image and whatnot. And then it had a percentage benefit for the optical. It is a very straightforward, clean benefit. I didn't want to make it very complex. I wanted it to be easy for my team to explain, patients to understand, and us to implement. So it's very clean and straightforward, just a flat percentage off of prescription eyewear, and then a different percentage off of Plano eyewear. And we apply that whether you're getting a complete pair or you're just updating lenses. It doesn't matter. You get the percentage. And there's not a one-time use type deal other than the exam. So the benefit for the membership in this plan was that they get an annual wellness eye exam, and then they get a percentage off of their purchase in the optical. Our second plan was the same thing, but we added in contact lens exams. And there was an additional benefit not only for the contact lens exam, which was included along with the wellness eye exam, but also a percentage off for the sales of contact lens materials through the practice. The third plan that we put into place was designed for those who had insurance benefits, medical insurance benefits, but no vision insurance benefits. And so that was more to develop a plan with optical benefits, material benefits, and covering or benefit for the refraction rather. What we saw in practice was that third membership plan is our most utilized plan, and it's utilized by those who we designed it for, who just have medical insurance and no vision benefits, but also those who have vision benefits as typical managed vision care plan, but what they were wanting to get was not a part of formulary. They weren't able to get through the managed vision care plan, and this gave them access to get those the products we recommended at a much more affordable rate and the value for it. The reason why I like the way that we've had this model is because in the past we may have looked at trying to find discounts if somebody hem and hawed in that sales transaction, and I didn't like it because discounts they don't drive loyalty, they don't give anything. I think subconsciously it really weakens our offer. But if I'm selling you a membership plan, or you're electing to buy a membership plan with us, nothing's being discounted. You get benefits that come along with that. Think of the gym next door to my office. Great having a gym next door. There's a day use. I'm out of town. I wanted to use it for the day, and there's one fee for that. If I choose to be a member of the gym, then it significantly reduces the cost if I go frequently. And if I choose a higher level membership at the gym, now maybe I have access to the coaching classes, the highest level maybe that comes with some personal training sessions. So there's tiered levels of membership that have different benefits associated with those, and that's the same as how we look at it for our practice.
The Myopia Collective. Cooper Vision and the AOA have partnered in a groundbreaking initiative to change the way optometrists in the U.S. treat children with myopia. The purpose of the Myopia Collective is to rally the profession of optometry and its allies to interrupt the status quo and elevate the new standard of care for children with myopia. Every individual is encouraged to become a member of the collective. By joining, you commit to taking action to help slow the progression of myopia in children. You'll receive updates and information about the collective and its work in the fight against myopia, gain access to educational opportunities and resources offered by the collective, and hear from change agents, the ambassador optometrists selected to serve as advocates for community and policy change that facilitates the mission of the collective. Scan the QR code or click on the link in the show notes to join the collective today.
In the past, our focus revolved around prescribing MacuHealth or MacuHealth Plus to patients at risk of macular degeneration, while also recommending it to collegiate and professional athletes for enhanced contrast sensitivity in sports performance. However, this year's introduction of the Life Meter has been a game changer. The Life Meter revealed a concerning truth. many of my patients have alarmingly low skin carotenoid levels, indicating potential deficiencies in essential body tissues like the retina and brain. Supported by over 30 peer-reviewed publications, LifeMeter's accuracy, consistency, and effectiveness has been demonstrated across 2,000 subjects with diverse backgrounds. With this newfound insight, I can now have meaningful conversations about carotenoid levels with all of my patients, even those who may seem outwardly healthy. To learn more about this empowering technology, feel free to contact your MacuHealth representative or click on the link in the show notes. Together, let's optimize patient care and elevate their well-being.
So is this good for the business? I think it's fantastic for the business. Number one, we're no longer discounting anything. We are providing an opportunity for our community to choose to align themselves with us by having a membership with Werner Optometry. It's something that we are proud of. It's something that we promote when a patient walks in. It's something we promote before they ever come in. It's part of the welcome to the package information. It's on our website. And so it's not a save the sale by any means. This is something that we make every patient aware of and offer to every patient. We believe in keeping it super simple. So I like the KISS principle, keep it super simple. That way anybody can describe it. If somebody comes and buys it at the practice and they go home and their significant other or spouse asks what it is, they're able to explain it. My staff's able to explain it without having to write anything down. It's very straightforward. And that's the way that I wanted it because it's easy to implement. As an optometrist, my first thoughts were what happens if somebody doesn't pay? What happens if people try to take advantage of the system? I know Chris and Renato covered that a little bit in their discussion. What I can share is that we really haven't seen that. You're always going to have the N of one or two that take advantage of the program, but of the hundreds that we have in there, I think there's been two that really has taken advantage of the program. What we see the vast majority of the time is that almost all of those who buy a membership plan with my practice pay in full upfront. So they're buying the annual membership in one lump sum. We have about 2% that pay on a monthly recurring payment. And of those, the biggest issue we've seen is that a credit card declined. And when they were reached out to, the number one reason was because that card number had been hacked or stolen and they had to get a new credit card. And as soon as the patient was made aware, they updated their credit card and everything ran smoothly forward. So we've only ever had, like I said, one or two individuals, period, not follow through with their commitment. And that I'm not worried about. That's just part of doing business. What I do see when I look back at the numbers, so I look back at 2025 in our practice, and we collected $30,001 in membership plan dues, collections, however you want to say it, and membership plan sales, $30,000 total in 2025. In the first quarter of this year, 2026, we've already collected 10,000. So we're on pace to do quite a bit more than we did last year. I love that because the reason we did membership plans was for access. And so this tells me that it is being utilized the way that it was designed to be utilized for access. Now, profit is something that I get to control with membership plans. Again, Chris and Renato, I think, did a great job of talking through that. I know what the fees are on my end for Vision HQ. I'm more than happy to pay those fees to transition the work and the headache and the monitoring and the engagement to Vision HQ for that service. But I have that built into the cost of the plan. And so really, I'm not paying for it. That's built into the cost of the membership plan. And so I can control exactly what my fees are, my profit is, because I know all of the cost of goods and everything that go into the program. The other stat that I thought was interesting is I wanted to know what percentage of our total wellness visits purchased a plan. Now, again, not all of these were the direct benefit for having the wellness visit as part of their plan membership, but I wanted to know what percentage purchased, and about 8% of our total wellness visits purchased a membership plan, and that's fairly significant. So we're pretty proud of that. Again, I think that membership plans, like everything else, is not for everybody. There's definitely not a one size fits all in the world of independent optometry. However, I do believe that there is a strong place for membership plans in our practice, especially as healthcare continues to evolve and change and the relationship between doctor and patient changes. We have a very unique role in optometry to have those tight personal relationships with our patients. And I think that maintaining access for the patients to us is very important. I think creating value is very important. And I think being able to use things like membership plans that help create and explain very clearly what that value is a fantastic mechanism and vehicle to continue maintaining the relationships we have with our patients and giving them access to us, both our current patients and future patients. Chris and Renato got into a little bit of the Community Connect, where there's an opportunity to uh, create memberships for those in your community. If you're in a strip mall like I am, or you're in an area where there's lots of small businesses who may not be able to give lots of benefits to their employees, this is a way to create an additional benefit, additional value that those businesses can offer their employees that directs the eye care back to your practice. So it's a win-win-win in that situation. So lots of good opportunities, lots of great things. The team at Vision HQ is fantastic. So please, if you have any questions, reach out to them. And I say that because that's been my experience in our practice. We've been with them for a couple of years now, and it has been very beneficial. If you have any questions, their contact info is in the show notes. You're also free to reach out to me. I'm happy to share my experience one-on-one with you as well.